Good morning, everyone, and welcome to our Zoom presentation on the PGY1 Residency Bootcamp. I'm Sakif Hassan, Young Physician Secretary from the BMNA. This presentation is organized by the Bangladesh Medical Association of North America with the invaluable assistance of our presenter, Dr. Farzana Haq, who is a tremendous mentor and support for our young physician. The PGY1 Residency Bootcamp is designed to equip you with the skills and knowledge needed to excel in your new roles. Before I introduce our speaker, I'd like to request our president, Dr. Bashir Ahmed, to say a few words. His support and enthusiasm always encourage me to arrange these meetings for our young physician.
Thank you, Dr. Sakif, and thank you, our speaker, Dr. Farzana Haq, and all the attendees here. And we are so excited to have you here in our BMNA arena. And we wish you every success in your life. And I still remember it was 25 years ago when I walked into my first day in residency, how confused and helpless I was, knowing the system, no matter how much you were exposed in different settings, but when you start working as an intern, first few days and a few weeks are really challenging. So we're trying to make it easy for you, and Dr. Farzana, with her tremendous experience working with residents and interns, she is a valuable asset to BMNA, and she's going to share a few of her recommendations and thoughts, and let us hear from her. And again, I wish all of you every success in your professional life. Thank you for joining.
Thank you, Bashir Bhai. It is my great pleasure to introduce our distinguished speaker for our today's presentation, Dr. Farzana Haq. Dr. Haq holds several prestigious titles and has made significant contribution to the field of medicine. She is an associate professor of medicine and the acting internship co-director at St. Louis University School of Medicine. In addition, she serves as the inaugural medical director at SSM St. Louis University Hospital. Dr. Haq is also the president of the Society of Hospital Medicine at St. Louis chapter and holds esteemed credential as an MD, MRCP, FSCP, and FRCP. Her dedication to medicine and her exceptional mentorship make her a vital resource for our young physicians. Without any further ado, please welcome Dr. Farzana Haq.
Thank you so much, Dr. Sakif Hassan. I'm tremendously honored and privileged to be here. First of all, I would like to thank BMNA, definitely Dr. Sakif Hassan, Dr. Bashir Ahmed, and all the other leaders who truly very much mindful to organize these essential workshops. Most importantly, the attendees, because without our attendees, without the bright new generation of physicians, no session is successful. So thank you so much for joining us, making this session valuable and truly worth to speak and spend time with all of you. I would like to congratulate to all who matched this year. At the same time, I know that couple of faces I know you are working on to prepare your application for next year. I also want to congratulate you because you have came so far, not only on your medical journey, you did steps, now you are dedicated to prepare your application. So you deserve a huge congratulations too because of coming so far. So this session is truly for everybody. I mean by that, if you are starting a residency, there will be a lot of valuable tips and tools for you here, as well as if you are preparing your application and about to your residency next year, you will be benefited from this session as well. So let's jump right in. The goal of this talk is first, we will understand what are the expected responsibilities of an intern. I completely agree with Dr. Bashir Ahmed. My situation was also the same. When I started my residency, although I did externships, but the expectation of an extern or observer is tremendously different than an expectation of an intern. And doesn't matter whether you are international medical graduate or American medical graduate. When you are starting your internship, you are same at the level of American medical graduate. So they expect you to same workload, they expect you the same productivity as the intern of American medical graduate. So we will highlight what are the expected responsibilities of an intern. Secondly, critical to know how the workflow in US hospitals. Maybe you have done your observership externship and you have some idea that the way we worked in our dearest home in Bangladesh is much different than here. So we will focus on what is the workflow in the US, and you will find this information valuable regardless you are starting your residency either in university program or community program and across any states. Thirdly, and I believe it's critical part of this talk, is to identify what are the common mistakes done by the international medical graduates during the intern year. Truly, I want to highlight all the mistakes I have made, also all the mistakes I have seen while working as the associate professor of medicine, while working with residents and medical students over the last couple of years. The goal is that you will not make those mistakes. You will be better positioned than I am when you are starting your residency. So let's focus on what will be the roadmap of this session. First, we will know what are the helpful 15 tips that you can use to stand out during your internship. Secondly, I will also share a couple of resources which you can use during your intern years. And after all this talk, I want to make sure that we have enough time to learn from expertise of our renowned physician, from Dr. Sakib Hassan, from Dr. Bashir Ahmed, because truly they have vast more experience than me. So they will also teach you some of the tips or also some feedback on these helpful 15 tips. And then I will be happy to answer any of your questions and clarify any of the tips which I will highlight now. So the tips number 1 is understand the expectations of an intern. So let's focus on what is the typical work day of an intern. And I would like to emphasize here that as an intern, regardless which program you match, which state you match, a big chunk of your internship will be inpatient in the hospital. So let's see how you will start your day in the hospital as an intern. First, during the daytime, you will get the sign out from your night team. Then you are expected to review all the morning labs, patient charts to understand that, okay, is there any change in the lab? Truly what happened overnight? Is there any new symptoms, anything going on? After you reviewed patient labs, patient chart, then you are expected to see patients. And during the first couple of weeks, most of the time, your senior resident will go with you to see the patient. However, don't be surprised that if your senior resident is telling that, okay, you can see the patient by yourself, because, there is not that much written rule about it. This is expectation that your senior resident will go with you. So if they're coming with you, that's fine. If they're telling you to go alone, don't be surprised. Then you are expected to place the initial order. For example, if the patient is having fever, you are expected to do that workup for that patient. You are expected to at least start the basic treatment regimen for that patient. And definitely at any time, you can talk to your resident to clarify your plan. Then again, after you have done the initial part of your workday, when your attending physician is coming, you have to round all the patients with your attending physician. After the rounding is done, usually, then you are again expected to follow the instruction. For example, your attending told that, okay, order the echo for this patient, call the infectious disease team for this patient. Secondly, you are also expected to place order, communicate with other team, communicate with nurses, and also communicate with patient and their family member. After all this done, then after the end of this workday, usually it finish around like 4 to 5, then you are expected to give the sign out to the next team who will take over from you. At the first couple of weeks, if you are staying a little bit late, then your senior resident, don't be surprised because this is a new system. You are learning it. So this is very natural that you will need more time than your other residents or like then the other intern who are maybe American medical graduate. But you are learning and you will go there. Then focus on what are the styles of rounding. The styles of rounding, mainly you can divide into two categories. One is table round, meaning your attending physician will sit together with you, with your other intern, with the senior resident, if there is any medical students, and they will talk about the patient during that time. And after you chart reviewed, after you discuss about the patient, after you have some plan that, okay, whether this patient will be discharged or what will be the next plan in treatment, then you are going to see the patients together or your attending is going by themselves. Let's focus on other style of rounding, that is at bedside rounding. You, with your whole team, with your attending physician, will go to the patient's bedside and then talk about the patient in front of the patient at bedside. So truly it depends upon the day-to-day, the complexity of the patients, the workload of that day, and also many times according to the preference of your attending physician, this rounding style could be vary time to time. American Medical Association, AMA, I will advise you to read this paper, that is the 5 skills residency program directors expect on day one. On day one, regardless whether you are international medical graduate or American medical graduate. So what are those things? Let's explore. First, you must have the capability to have case presentation. It need to be concise, definitely need to be better level than the medical students if you are working with. Secondly, formulate at least couple of differential diagnosis and essential workup. Truly, I see that many times our international medical graduates are much more equipped to that part than maybe many American graduates. Thirdly, thought process about discharge plan. Like, okay, if you have some patient you just got, you have to have some at least idea that what are the things needed to be done to make sure patient will be discharged safely. And then complete the required task. If they are asking you to place any order, call anybody, talk to anybody, please make sure that is done in a timely manner. And then communication. This medicine rounding is all about communication. You are communicating with your patient, patient's family, nurses, other team member. So these are the basic things you must be done as an intern. Then let's focus on how you will like follow up all those things. Please take ownership, whatever order you are placing. Make sure you are having some checklist so that all the work are done in a timely manner. You do not want to, come home and then remember, oh my God, I forgot to do that. And maybe, sometimes you have to go back. So please take ownership of all the work you are expected to do and follow up on those. Remember, in the US, it's not like our back home Bangladesh. Okay, so there is a high risk of malpractice lawsuits, and most importantly, patient safety, patient care come first. So if there is any order not being followed or not being ordered in a timely manner, and God forbid, if that impact patient care, that's a red flag for any intern's career for the hospital. So please be mindful about that. Then we will focus on tips number 2, and that is know the baseline. So what do I mean by know the baseline? For example, know the baseline mental status of a patient. I can guarantee you that when you are working as an intern, as there are a lot of baby boomers, a lot of elderly population in the whole USA, you will get many elderly patients who will change in mental status. So it is critically important to know their baseline mental status. For example, if a patient was walking, talking, doing all the works, and now coming with change in mental status, your workup approach will be different. In contrast, if you have a 75-year-old patient who has dementia, Parkinson's disease, and now have change in mental status, your approach would be different. So understanding the baseline mental status is absolutely critical. What about creatinine? You know that when there is that creatinine, now we have this definition, acute kidney injury. You will get a lot of patients with acute kidney injury. So same rule apply. Make sure you know patient's baseline creatinine to understand, is it acute kidney injury? Is it acute on chronic kidney injury? Or simply patient has chronic kidney injury and creatinine is close to the baseline. So we do not need to do $1 million workup. Thirdly, EKG changes. You and me know that, okay, there is a drastic difference in management plan between new left bundle branch block compared to patient already has left bundle branch block for a couple of years. So whenever you are doing any EKG for chest pain, and I can guarantee you, you will get a lot of call for chest pain during your entire year. Doesn't matter which specialty or which hospital you work. Please make sure you know patient's baseline EKG. If you are doing a new EKG, take time. It just takes few minutes to compare it with the previous EKG to understand, is there any new changes or is this is something going on for a long time. CBC, you will have to do this test very often. So if the patient is requiring hemoglobin, you need to understand that, okay, is this like acute on chronic anemia or acute anemia? So understanding the baseline hemoglobin is very important. Now we will focus on our tips number 3, which is which things you must check before prescribing medications. Imagine you got a call from your nurse to order something for your patient. You ordered the medication, and after 10 minutes, you are getting call as your patient getting this huge swelling. You definitely do not want to be that intern, right? So that's why whenever you are asked to prescribe any medication, please, I cannot stress enough, make sure you are checking for allergies. There will be separate bar under the electronic medical record for allergies. Make sure you are checking it. Secondly, QTC interval. There are a lot of medications that can prolong QTC. So if you are prescribing some medication that has chance of QTC interval prolonging, make sure it's not more than 500. If it is more than 500, try to use other medications. Always double check the medication's route, dose, and frequency. You will see there were millions of medical errors happened worldwide in the US when a physician was not that much aware, maybe not double checked. Nobody also paid attention about the route, dose, or frequency. And ultimately, that caused death. I know that we now have electronic medical record, so things definitely got better than the paper chart. However, you will be surprised to know that many things, many error mistakes are still not captured by the electronic medical record, still not maybe captured by the pharmacy, nurses. Mistakes happen. So please take the ownership and always double check the route, the dose, and frequency of the medication you are prescribing, particularly for the first couple of months, because EMR is very, very new for you. And antibiotic stop date, if you are intending to have 7 days, 10 days of antibiotics, make sure you are placing the stop date of that antibiotic in the electronic medical record. We will now focus on our 4th tips, which is learn your electronic medical record. Regardless of hospital you got matched, you will have electronic medical record or EMR. Truly, electronic medical record is your friend, because as an intern, as resident, and even I as attending physician, I spend a lot of my time with the electronic medical record for reviewing patient data, for charting my order, for documenting my note. So learn your electronic medical record. On the first day, when you are working with your senior resident, request your senior resident to share the template of history and physical, progress note, discharge summary, ICU note, because as an intern on day-to-day basis, you must have to write those notes. So if you are pragmatic about it, to ask for the template from your senior resident, it will make your life much, much easier. So ask for the template, take all the efforts to learn the electronic medical record. For first couple of weeks, if you are not sure about to find the order, you can ask your co-intern or ask your resident or attending physician. Make sure you are knowing how to place the right order in your electronic medical record. Now, tips number 5, patient discharge process. So in hospital, this is a process. You are admitting patient, you are taking care of them for a couple of days, and then you are expected to discharge them. I always tell my residents, my medical students, that our goal is not only discharge. Our goal is to safe discharge of patient, and safe discharge require lot of planning, lot of workup, lot of initiatives. So the question is, when will you start planning for your patient discharge? The answer is as soon as you are admitting the patient, you must have to keep in mind that, okay, what are the things going on, which things I'm doing right now, what are the acute issue, and how we can do all the workup so that patient can be discharged safely. I always say, not only for international medical graduates, truly it makes me so surprised that American medical graduates also sometimes feel so much challenged to find out that, okay, which place the patient will be discharged, whether the patient will go to nursing home. So this part of this talk is very important, that you will be much more confident and in ease when you are discharging patient during your internship from this section. So in the US, it's not like Bangladesh that, okay, all the patients are truly going to home. Besides home, there are a couple of other options. One is nursing home, then acute rehab facility. So the difference between nursing home and rehab, truly, they will get the physical therapy, occupational therapy, much more hour in rehab compared to nursing home. And then long-term acute care, or LTAC. Long-term acute care will be the patients who have tracheal tube or who are on ventilator. Those kind of sick, complicated patients will go to long-term acute care, or LTAC. So the main question is, how can you find out where your patient will be discharged? The answer is, for every hospital, there is physical therapy, occupational therapy. So their job is to work with patient. Their job is to assess that, okay, how is the patient's functional capability? Is the patient able to walk? Is the patient able to dress up? Is the patient at high risk of fall? So their job is to work with the patient and assess. As you can see in the picture, that these two staff are working with the patient and they're assessing that, okay, how is the mobility status or functional status of this patient? That will decide whether this patient will go to home, nursing home, or rehab facility. So understanding the difference between social worker or case management is vital. When I first started my internship, I literally had no idea that, okay, who are this social worker, who are this case management, and what they're doing, why I need to pay attention to their note. So I want to clarify that part for you so that you know it from the first day of your internship. If the patient is going to be discharged to nursing home or rehab, you are expected to contact social worker to find out that, okay, when they can be discharged or what is the update of their facility arrangement. In contrast, if the patient has been decided to be going to home by physical therapy, occupational therapy, then you are expected to case manager. If you remember these small things, it will make your life much, much efficient during your intern year. The tips number 6 is understand the chain of command. The chain of command is very, very important in medicine. So respect, observe, and learn from your senior resident, from your attending physician. If you in doubt, if you have any question, always let your senior resident know first, then the attending physician, because that's the chain of command. It's not like that you cannot ask question your attending physician. You can absolutely ask question your attending physician. At the same time, this is kind of chain of command that you should approach to your senior resident first if you are facing any challenges or if you have any question or uncertainty. When you are asking any question or when your resident or attending physician is telling you something, I cannot stress enough how important is it to listen. We have 2 ears and 1 mouth for a reason. So please make sure to listen. I understand listening, that okay, be a good listener. It's very easy to say, but difficult to do. At the same time, we all know that it is crucial to do. So make sure you are listening carefully when you are given to any task, when you are given to any instruction by both your resident physician, your colleagues, and from your attending physician. Feedback. During your internship, during your residency, you will get a lot of feedback. In fact, as an associate professor of medicine, I get continuously feedback from my medical students, from my residents, from my multiple boss, like, from my boss as the academic physician, from my boss as the medical director. So feedback, this is an integral part of workflow anywhere, particularly in the US health system. This is absolutely integral and critical. And make sure feedback is a gift, because sometimes as a human being, as a new system, new culture, we have so many things to care about. We have so many things to learn. Mistakes can happen. It's truly very, very natural. There is no physician can tell that, okay, they did not make any mistakes and learn from it. As long as you reflect on your mistake, you reflect on your shortcomings, you learn from it, that truly matter. So when you are getting any feedback from your resident, attending physician, colleague, please make sure to reflect on it, because this is a gift. Welcome and learn from feedback. As an intern, you are not expected to know everything. However, you are expected to reflect on your mistakes, to reflect on your shortcomings, to listen to the feedback. At the same time, work on that feedback so that you are a better intern, as well as you will be resident soon. You will be attending physician soon. So make sure to do that. Do not take it personally. This is nothing personally. This is all about professional expectation. And feedback will be given and received by anybody on this planet. Ask for help when needed. And if you are not sure, as I have already emphasized, patient care comes first. If there is any fatal mistake, if it is detrimental to the patient, any interns, any attending physician career will be jeopardized. So please make sure you are asking, you are clarifying if you are not sure. Nobody expects you to know everything. I want you to remember that, because this is a new system, new culture. And patient safety always, always come first. And you have worked so hard to come so far. Remember how many birthdays you have missed, how many nights instead of sleeping, you are preparing for your USMLE, for your interview, for your personal statement. So your career is crucial. Now the tips number 7, which is night floor rotation. As an intern, at least 1 or 2 months, depending on your program, you will be required to work on night shift. And I can share with you that for any intern, regardless they are American graduate, international medical graduate, starting night flow as an intern could be a little bit intimidating. So my goal is to share couple of helpful tips with you in this segment of this talk so that you are a little bit more comfortable, more in ease when you are starting your night floor rotation. Sign out is the key. Remember, the day team, they may be so much tired, they had to do a lot of things. Even if they forget to give you any sign out, please always ask specifically about, okay, is there any sick patient? Is there any patient they are thinking that, okay, patient need ICU or patient could be critical situation overnight? Sign out is your key. Always ask specifically about sick patient. Please do not keep it by chance. Always be mindful to ask about the sick patients specifically. If you are getting call about a patient, I will request you to have very low threshold to go to the bedside and assess the patient. 99% of the time, you will be called by a nurse about any question, about any lab, or about any situation of any patient. After reviewing the chart a little bit, like, very briefly, please go to bedside. Have very low threshold to go at bedside and assess the patient, particularly for the first couple of months of your internship. Sometimes maybe you will see that, okay, nothing need to be done. Patient is fine, patient is stable. Please make sure that you are communicating with the nurse. And document. If you take one point from this talk, that is document. There is a drastic difference in healthcare system, in healthcare expectation between our back home and US. Here, documentation is everything. If it is not documented, it did not happen. I want you to take this key message with you from this session, because you must have to document what happened. It could be few lines. It does not have to be huge documentation. However, please make sure you are documenting what happened, what you did for that patient. Even if you spend 1 hour to the patient, if it is not documented, it did not happen. So always document overnight significant events for your patient. If you just order Tylenol, or if you just order some Zofran, anti-nausea medication, you do not have to always document. In contrast, if the patient was having chest pain, if the patient was having fever, if there was any major change in the medication you did, please make sure that is documented. Now we will go for the tips number 8, that is rapid response and code blue. When I started my residency, I literally had no idea what is this rapid response and code blue. But I can tell you, on my first day, my resident expected me to know what it is and to perform at the level of American medical graduate. So let's see, what are these? So rapid response, they will call that, okay, when the patient is sick, they will call the on-call team. So you have to go to the rapid response along with your team who are sick and nurses think that, okay, they need immediate attention. That is rapid response. What about code blue? Code blue is that, okay, when the patient is absolutely critically conditioned, patient may have cardiac arrest, patient may patient is not responding, patient does not have pulse, patient is unconscious. That time they are calling code blue. It's kind of like, very emergency situation in the hospital. They expect you to be there right away, and you will see a lot of people are there, like anesthesia, the ICU team, the respiratory therapy, all of them will be there. I do not want you to be master of rapid response and code blue on the first day. Please do not expect that. This is the new thing. As long as you are there at the bedside along with your team, as long as you are following the instruction of your resident, that is enough, at least for first few days. And your resident, your senior resident will tell you that, okay, what he or she want you during that rapid response or code blue. So please follow that lead. And as an intern, you are not expected to lead the rapid response or code blue. However, you are expected to follow the instruction of your resident physician as well as attending physician. And again, the more you will see these things, the more you will become better. And I would like to also acknowledge that this rapid response code blue, these are highly stressful situation, not for the patient. Patient is definitely uncompensated, but for the new team as well. So it is very, very natural to feel little bit overwhelmed, to feel that, okay, your heart rate is jumping. So this is very natural. It happened to all of us. Just deal with it and make sure you are at bedside for that rapid response code blue along with your team, and you are following your senior residents' instruction. The tips number 9 is document properly and timely. Because when you are writing the progress note, history, physical, discharge summary, you must have to complete on that day. Particularly for history and physical and progress note, you must have to complete. For example, if you are seeing the patient today, you must have to complete the note today. And the discharge summary is like, please make sure you are doing on the day of the discharge, because every information is fresh on your mind. It will be much easier for you if you complete the discharge summary on that day. And again, to emphasize that I have already highlighted that if you did not document, that did not happen. And I know that I have already emphasized that on the first day, when you are starting your rotation, ask your senior resident for the template so that it is much easier for you. And you are not wasting time to write everything from the scratch. If you have the template, you will be surprised that, okay, how much things are much smoother than comparing without any template. Now the tips number 10. Medicine is a team sport. This is not individual. Here, particularly in the US, doesn't matter if you are professor, if you are dean, this is a team sport. You must have to have the capability to work in a team. And it is crucial to know your whole team. And team doesn't mean that, okay, only your co-interns, your resident, your attending physician. Remember, nurses, physical therapy, occupational therapy, respiratory therapy, the whole other team, they're your team as well. So know your whole team. Please make sure you are knowing them, you are respecting them. And I'm so much fortunate that whenever I'm seeing the patient, they know that I respect them and they respect me highly too. And things are much easier. If you have good rapport with your team members, with the nurses, things will be getting done very, very easily. And that has been my experience. Your colleagues are truly your asset. Your co-interns, your residents are your colleague. So attempt to join if there is any residents gathering. If you are not able to join, maybe you are on call, you have some family obligation, or you are off that day, you do not want to come. If that is fine, but please make sure you are informing them earlier and try to join at least most of the resident gatherings. Professional societies, there are a lot of wonderful professional societies like BMNA. Besides BMNA, I know that they will have workshops. Make sure you are attending those. There are a couple of other professional societies like Society of Hospital Medicine, American College of Physicians, American Medical Association. And I do not have any financial relationship with this society. However, for your benefit, I would like to highlight that as the intern resident, you will get free membership. And there are a lot of highly valuable, helpful educational tools in their website. Those are freely available. So please make sure you are sometimes going through them to improve your skills and expertise. Tips number 11 is be aware of HIPAA. I believe when you prepared for your step 1, step 2, you know what HIPAA is. That is like, every patient information is confidential, and we must not disclose any of the patient information with the other people who are not involved in patient care. So be aware of the HIPAA. And how can you do that? For example, when you are intern, you have to carry at least 5 or 6 patients. And from the electronic medical record in the morning, you are printing out the list. Please do not lose that list because it has all the patient information, name, age, sex, all the information. Please do not miss that. That will be a huge threat of violating HIPAA. Secondly, do not leave the patient's medical chart open, because when you are typing on the computer, if you have any call or if you need to go to see any patient, please make sure you are closing that patient chart. You are signing off from the computer before you go. For example, if one intern is asked to see a patient and if the chart is open, if somebody is looking at that chart, that is a HIPAA violation. Please do not take any risk. Be aware of patients and relatives around you. One of the tips I would like to share that, okay, if there is any family member at bedside, please make sure you are asking patients permission before talking about patient's diagnosis, patient sensitive information. We know that, okay, for any sexually transmitted disease, HIV, all those crucial information are very, very private. Along with that, any diagnosis, I will highly recommend you, if there is any family member at bedside, even if it is a spouse, please, you have to ask the patient's permission to disclose that in front of the patient. And do not discuss about patient's information in the elevator, in the cafeteria, in any open space. That is always a huge threat of HIPAA. You do not know who is around you. So please be mindful about this extremely sensitive issue in the US. Tips number 12, didactic session. So far I will highlight 15 tips with you, and now we are at 12 tips. So we are coming very close to the session. So make sure you are preparing your questions so that you can ask our renowned physicians here who are present with me today, as well as to me. The didactic sessions, there will be like morning reports, noon conferences, grand rounds. You are expected to attend each and every session. If you are off any day, that's fine. You do not have to join. However, if you are working, you must have to attend all those didactic sessions, morning report, noon conferences, and grand round. And I see it to benefit for this. First of all, they are truly preparing all those talks, all those lectures by spending at least couple of hours, like at least 20-30 hours is needed to prepare any talk. So if they are giving you all these lessons in a condensed manner, please make sure to join to improve your expertise, to improve your skills, to make sure you are doing better job as an intern next time from these lessons. And secondly, as an intern, as a resident, each year you have to go through 8 hours of exam, and that is mandatory. And if you are attending all these didactic sessions, I can assure you, your exam will be much, much better, much, much easier than you are trying to read all by yourself. Because the reality is, internship, residency, they are very busy. You will not have the time to study every day. This is the reality. However, if you are joining all those didactic sessions from your hospital, you are automatically prepared for that. And I can share my experience, because as soon as I completed my residency, from next day, I had to attend a job. So I could not take even one day off for my board exam, I could not afford to do any kind of like coaching session or any kind of training for the board exam. However, I truly believe that, okay, although I did not get time to study, as soon as I finished my residency, I passed my board in first time because of all these didactic sessions. Those were truly, truly helpful for me to learn and pass those exams. So they are mandatory and they are truly useful for you to grow professionally and pass the exam. The journal club presentation as an intern, regardless of your program, you will be at least expected to do some presentation. It could be case presentation, it could be journal club presentation. When you are doing journal club, then that time you will be asked to have some few slides, maybe 8 to 10 slides about an article. So choose the article what you feel comfortable to present. If you are feeling that, okay, this article is comfortable, I know this article, make sure you are presenting that. Do not take so much burden that, okay, it must have to be coming from any GM or JAMA. If you like something, you can present it. And make sure it is concise. Now, the tips number 13, be on time. In this country, I firmly believe that 10 minutes earlier than your scheduled time is on time. Every day when I'm in the hospital, I'm always 10 minutes early than my scheduled time. Please make sure you are on time. I cannot stress enough. It may sound very, very simple, no-brainer. However, it is critical. Oprah Winfrey said that you have to keep yourself full. And truly, that's our job. As an intern, you will see thousands of patients. I was attending a grand round, and I was very surprised to find out that in our hospital, interns see at least close to 2,000 patients each year. So you are seeing and helping a lot of patients. At the same time, you must have to take care of yourself first in order to take care of your patients. So how can you take care of yourself to serve others? On the top of that, you have your family. So make sure you are having some time with your family as well, because they have been your support during your hard time. Now, when you are becoming a physician in the US, when you are fulfilling your dream, we must have to make sure we are valuing our family life as well. That is critically important. Our sleep. Even if you are working in night floor, make sure after you going home, at least having some nap before come back. If you working on daytime, make sure you go to bed early so that you are resting properly to come back next day as fresh and energetic. Snacks. When you are coming to hospital, have some healthy snacks. Maybe, some fruits, some nuts, have some snacks with you. Vacation. Regardless of your program, you will be given 3 to 4 weeks of vacation. When you are vacation, you must be on vacation. Do not try to study or do not try to do anything your residency related. Please enjoy your vacation. And I will highly recommend to take that time off, because when you are coming back, you are like much more energetic and having fresh perspective. Do not beat yourself that, okay, you have to do work during your vacation. That time you should be enjoying and should be giving time to yourself and to your family. And again, to emphasize, I know that many people have to utilize the vacation for step 3. So, if you have not done your step 3, make sure you do so, because that's always helpful. What are the handy tools you should have when you are in the hospital? Phone charger. Nowadays, our life is critically integrated with our phone. So have the phone charger, because if you are using anything from your phone, like up to date, if you are looking up to anything, make sure you have the phone charger with you. Secondly, pen. I cannot tell you that how many pen I have lost and carried as an intern. So have more than one pen with you and be ready to lose some, because I can assure you every physician had lost some pen during their internship. A small blanket for night calls. I do not know why. At some way, all the hospitals in the US are extremely chilly during the nighttime. At least that is my experience. So have a small blanket if you are working in night shift. Learn driving if you are going to a place where public transport are not easily available. If you are doing your internship in New York, fantastic. I do not think that that's a priority. However, if you are like me, where you are doing residency, that okay, where public transport is not available, like New York, please make sure you are learning the driving. Stay close to the hospital to save your commute time. Almost each and every day, I was in the hospital around 6 o'clock and then maybe 6:30 when I became senior resident. So stay close to your hospital. You will save so much time to commute if you are staying close to your hospital. This is our final tips. That is tips number 15. Be mindful. Truly, be mindful about your emotions. This is the overwhelming task. Everything is new. You are new, patients new, system new. It is very natural to feel sometimes overwhelmed, frustrated. Please be mindful. Okay, this is a professional setting. Be mindful of your words, be mindful of your action, emotions, and most importantly, what you share with your colleagues. And they are definitely not your friends. This is their professional courtesy. Please be mindful how you are approaching people. And one of the tips I would like to highlight, because I see that many international medical graduates forget about that in the US, it is professional to address people with their last name. For example, if you have an attending physician, make sure you are addressing them with the last name, with doctor, because it is not very professional to address a first name in the US in professional setting. In contrast, your co-interns, your residents, you are almost at the same level with them, and you are welcome to acknowledge them with their first name. However, again, to emphasize, if this is professional setting, always follow the US culture rule and address them with last name along with the doctor. I would like to share a couple of useful resources that I do not have any financial tie with them, because I believe they were very much useful for me when I started my internship. One is this book, that is Internship Survival Guide. I do not think that you have to buy, because almost all the programs, they give this book as complimentary to their interns. And I will highly advise you to read the 2 chapters. One is admission, another is top 10 workups. And also up to date, this is the resources. Hopefully it will be given by your program without any cost, and take the advantage if you are not sure to take a look in the up to date. And also this book will be most of the time given as a complimentary to the interns, that is pocket medicine. I will advise you to read at least first 10 chapters of this book. You do not have to read line by line, just have a glimpse on it to make sure you are refreshing your mind about those basic workup. And you will be seeing that, okay, many interns, they will be always carrying this book with them, and I will advise you to do so at least during your internship. In summary, take the ownership of your patients. Please take the ownership of the order or all the tasks you are suggested to do. Ask for help when you are not sure, because patient safety comes first, as I already highlighted. As an intern, everybody knows you are new, and that's why you are training, right? If you would know everything, then you will not be in the internship. So this is very normal, and every physician had to go through that phase. So everybody knows that, okay, it is expected that you will need help. So ask for help. Document properly and timely. As I mentioned, if you did not document, it did not happen, at least in the US. Learn from feedback, because feedback is a gift and you will get a lot of feedback. I'm continuously getting feedback, and for this talk, I will also be appreciating you if you share your feedback with me. That will help me to grow and give a better talk for the next group of physicians. Most importantly, enjoy your training, because Now you are, after doing a lot of sacrifice, after doing a lot of hard work, you are here because you wanted to be here, you were dedicated to be here. You have worked so much hard for it. So enjoy your training because this is your opportunity and you got it. After this talk, I will welcome your questions. I will welcome your comments. And now I would like to invite our two wonderful physicians, Dr. Ahmed as well as Dr. Hassan, to comment on this talk or also share their perspective. And then also I will be happy to answer your questions. Thank you so much once again for this invitation and for this opportunity to spend time with you before the initiation of this important training of your life.
Thank you, Dr. Farzana, for this excellent presentation and this valuable discussion. I would like to open the floor for any question. You can unmute yourself if you have any question or any comment, please. Okay, I think there is no question, but you can always raise your hand or you can unmute yourself if you have any question for Dr. Farzana or for any of us. A couple of things I want to add that one important thing is to introduce yourself. Like whenever you go into a patient, make sure you introduce yourself because the patient are seeing many physicians in a day. And if they don't know your role, it's very difficult for them to find out who you are. So like the way that if I go into see a patient, I would say, okay, hi, I'm Dr. Hassan. I'm one of the intern in the internal medicine team, and this is my team. I'm here to help you. So it's a simple way to introduce yourself. There is another thing is very important in the USA is to address or the pronoun. So there, I'm pretty sure maybe you already know, but if you don't know, please try to learn about the pronouns. There are two different, is there binary or non-binary? Some of the EMR already has a format that they usually put it in there, how the patient want to call themselves. If you don't know, it's very normal. You can always ask them, can you please remind me what pronoun you use? And because if you start with a different pronoun that the patient does not like, you start with the wrong foot with the patient. So please make sure that you pronounce themselves in the right way that they want to be. The other thing is it's very normal that you are PGY1 internship. It's very normal for you to not to know anything. If you don't know anything, please ask for help. Don't think that, oh, I'm supposed to know everything and then I cannot call my seniors. Don't make that mistake. Anytime, any emergency, if you don't know anything, please call them. The other thing I can say, like difficult patient, don't go into the argument with the difficult patient. Sometimes in the hospital, we see people are waiting in the emergency room for like 6 hours, 12 hours. You go in to see the patient and patient already frustrated, complaining you all this thing, doing behavior with you, attitude with you. But step out, tell them, okay, I'm here to help you. I apologize. What can I do? I understand that you're waiting for emergency room for a long time or this thing happened to you. Is there any way that I can help? Sometimes patient come down with this thing. If you think that still it's not helpful, you can always ask for patient advocate. Most of the hospital has patient advocate. So you can call for patient advocate. They will come and they will speak to the patient and then hear their complaint. Don't go with the argument. If you think that it's not going in a good direction, step out, ask your senior resident to help you. And apologize, please. If there's some mistake you have done, it's very normal to apologize and you will see the patient will appreciate that. Also, it's very normal to have mistakes. Like I can share one of my experience. Is very normal because you will make mistakes, that's for sure. But admit your mistake, and then you will come out of it. One time, when in my internship here, I discharged a patient who is not supposed to be discharged with the IV line, and patient was like in terminal stage going to the home hospice. I realized on the next day I discharged the patient with the IV line, which the patient was supposed to be taken out the day prior. So what I did, I informed my senior resident and the chief resident. We had a discussion. We could not bring the patient from home because she is an event patient and at home. So what I did is unusual, but I went home in the middle of the night at 11 p.m. I took out the IV line, I came home. So this is sometimes you have to admit your mistake and then try to solve it instead of just hiding. That will help you in the long run. Don't text your frustration. PGY1 internship is very stressful. It's not meant to be easy for any of us. So we all went through this. I understand it's difficult. You should know that it won't be easy. So don't be stressed out. Don't text about your frustration to anyone. Suppose if you have an argument with anyone, texting is a documentation. Email is a documentation. If you have frustration with anyone, make sure you don't text it, because in the long run, it may become a document against you. So stay away from texting about your frustration or email about your frustration. Give us some time. If you think there's something you want to mention to your program director, think of for one day and do it on the next day. Okay, this thing I need to bring up. Sometimes you'll see that your rage or your anger come down on the next day. So give some time for that. Another important thing I want to say is a chaperone. About any sensitive exam, don't forget to take a chaperone. Even if it's emergency, patients are complaining of anything, ask the nurse to be with you, especially rectal exam, breast exam, and document who was chaperoned with you. It's very important about document. You use the chaperone, you didn't document, that means that you didn't do it. And then sometimes complaints come, and I can see many residents and fellows, they're in trouble with this chaperone exam. And I think finances is also important to think about your finances. This is the time in the residency, because of an income limit, you are eligible to like put money in the Roth IRA. Learn about the Roth IRA. After some time, you won't be able to eligible when you become the attending. Learn about your finances in the USA, because that will help you also in the long run. Up-to-date Hippocrates, these are the important helpful resources that you can get. Most of the hospital has up-to-date subscription. You can ask your senior resident, they can tell you up-to-date subscription. Hippocrates is a free subscription, some part of the free. So you can still get all this drug like formularies and the doses from the Hippocrates. So you can subscribe for that and you can get free resources from that. And I think Dr. Farzan already mentioned about to become membership for all this organization, SCP, especially we highly recommend SCP, Society of Hospital Medicine. This can help you. Try to attend every yearly seminars and the conference on the SCP. You will learn many things from there. Any other question anyone have?
Dr. Hassan, thank you so much for sharing all these valuable lessons. I have also learned, truly appreciate it.
Okay, thank you.
I see with us, Dr. Mamun is here.
Dr. Mamun, are we still here?
Yeah, hi.
Assalamu alaikum.
How are you?
Dr.
Great, how
Mamun, I
are
want to
you?
say something. I want to say something, Dr. Mamun. So Dr. Mamun just came from the Hajj last night. And
Mashallah.
after a long flight, and then this is his dedication, how he's supportive for our young physician and all this program. Thank you, Dr. Mamun. Thank you for attending.
Thank you. And
Thank you,
I
Dr.
thought
Mamun.
it
You are the
was-
best.
No, thank. But when Farjana talk, nobody can talk. She was so thorough and details, you cannot miss anything. Thank you again for the wonderful presentation. And thank you, Sakib, for this arrangement. And for the young physician, I just want to add one thing. We are always telling that no one expected that PGY1 will know everything. It's true. But again, patient safety is the first, and there is zero tolerance. So keep in mind. So do not make any mistake. You have room to ask for help. If you don't know, don't do it. Ask for help. Your PGY2, your attending. Sometimes most of our hospital at this moment has the covering attending, in-house covering attendings are there. You can easily reach them. Even for any reason, if you cannot find anything, you can reach the chief president. They will be always helpful. But do not make any mistake. Any mistake could be detrimental for your career. And unfortunately, in the title is the boot camp, right? So your first impression could be your last impression, or at least would be the long-term impression in your residency career. So be careful about that. Too many helps are there. You cannot imagine, just it's your responsibility to ask for help. People are ready to help you out. Thank you.
Thank you
Thank
so
you,
much,
Dr.
Dr. Mamun.
So I'd like to congratulate everyone again for your residency match, and we look forward to supporting you throughout this transformative year. If today's discussion helped you to boost your confidence and support in any way, that is our achievement. Okay, thank you so much. Thank you, Dr. Farzana.
Thank you. I was wondering if Dr. Ahmed want to share any of his wisdom words.
Thank you, Dr. Farzana, and thank you, Dr. Mamun, for returning safely. and, joining with us, after a hectic flight. So Dr. Farzana is always you are phenomenal. And I hope you continue to help not only our young physician, the whole physician community with the BMNA flagship. So in terms of the training part, I had done and completed it so long ago, and I'm not part of any residency training now. So I actually don't know, all the new advancement. I heard, the life has gotten better in terms of the workload, responsibility, and other things. So I'm not going to repeat, what already been said. The best part, the take-home message for our young resident will be, you are not alone. Because that is very scary when you feel the help are not available. So as Dr. Mamoon said, the help are there. This is your intelligence you need to use how to get it. And people are there to help. So please, again, that know who you can go to. The first day, this is the number one thing. You need to figure out when you need help, who you're gonna go to and how you're gonna get the help. And if you can do that, you will survive through the residency. It will be a piece of cake if you know where to get the help. Thank you.
Thank you, Dr. Ahmed. Truly appreciate it.
Thank you, Dr.
Assalamu alaikum. Dr. Hassan, so thank you very much. And my name is Dr. Gopal. I am applying residency this year. I live in Canada. So probably this session I will get again for if I get match, but still it's very fruitful for interview preparation, I think. Because during if I achieve any interview, then probably I can get ready some talk for my interview based on these informations. I think that will help me in the long run. And also thank you very much for nice presentation, Dr. Hawk. You just mentioned so many things that is quite different from our home country residency. So that's very important for US. And also Dr. Hassan, I also liked your that mentioning that chaperone and also the documentation. And thank you very much, Dr. Ahmed, for telling that you are not alone. That's really hopeful word. And so actually this is the opportunity. And also thank you very much, Dr. Mamoon Bhai. This is actually my great opportunity. I contact through Messenger or Facebook, but it's I don't want to miss this opportunity to say some words for you. So thank you very much. Salute to you, everyone.
Thank
Thank you,
Dr.
Dr.
Mondo.
Gopal. Thank you so much. Okay, so maybe with this we can conclude our session. Thank you. You all have a wonderful day.
Thank you so much, everyone. Thank you.
Thank you. Bye-bye.
Bye-bye.
Sakib,
জি বসে ভাই
so আমাদের তো আরেকটা session is coming up in few hours. So তোমার did you talk to Kennedy bhai?
বসে ভাই I will call you in the phone. Let me end this meeting.
Okay.